Good morning, good afternoon. Allow me to present this abstract entitled Acceptability, Values and Preferences on HCV Self-Testing among the General Population and Healthcare Workers in Rwanda. As a background, over 58 million people worldwide are infected with hepatitis C virus, and majority of them remain undiagnosed. Following the publication of the WHO global targets for countries to eliminate HCV infection by 2030, there is a need to increase access to testing, and new testing approaches are necessary to raise populations' knowledge of their HCV status. In 2018, Rwanda launched a 5-year HCV elimination plan to screen 4 million people and treat confirmed positive cases. To date, the plan has been updated to 7 million people, and 5 million out of them have already been screened. To accelerate the implementation of this plan, increased access to HCV testing is needed to expand testing services in the community. HCV self-testing is among the innovative strategies that could empower people that remain unreached by current conventional facility-based HCV testing approaches. HCV self-test holds the potential to further increase uptake of HCV testing services by giving people the opportunity to test discreetly and conveniently. A qualitative study has been undertaken to assess acceptability, values, and preferences on HCV self-testing among the general population and healthcare workers to provide recommendations for future implementation of HCV self-test program in Rwanda. As methods, the study was conducted in Masaka District Hospital, located in Kigali city of Rwanda. It comprised of 72 participants divided into 2 groups. The first group is the general population, composed of 36 participants, and the second one is composed of healthcare workers and had also 36 participants. Individual interviews, group interviews, and participatory action research activities were conducted. As results, majority of informants appreciated the HCV self-test as an innovative way that could allow people to test in private, know their status, with no need to travel to a health facility. But also it could reduce time and cost while traveling to the health facility, as well as the waiting time and workload while at the health facility. It could also increase accessibility to HCV testing and allow people to keep results confidential, reduce stigma, and take an autonomous decision on seeking further HCV care, and then contribute to early treatment initiation and further reduction of transmission. Preferences towards HCV self-test included the need for a full-time and easy geographic access of HCV self-test at the distribution point, the need to offer HCV self-test free of charge or at a very low price, the need for a confirmatory test following a positive HCV self-test, the need to have visual, easy to read and understand instructions for use of HCV self-test, and the need to support illiterate people and people with visual or cognitive disabilities to prevent their exclusion from innovation. Some disadvantages that were highlighted included the possibility for errors while testing alone, the lack of pre and post counseling sessions, as well as the potential for psychosocial harm, which may follow a positive HCV self-test. Strategies to prevent or reduce negative consequences of HCV self-test included the support by a healthcare worker or via a free hotline. As a conclusion, HCV self-test was perceived as an innovative way that could facilitate and increase access to HCV testing, as well as the uptake of HCV testing. It's expected to reduce the required travel cost and time for HCV testing, but also the waiting time and workload while at the health facility, and will allow people to test in private, keep results confidential, and reduce stigma. I would like to acknowledge all the involved institutions, which are FIND and RBC, but also all the authors that contributed to the initiation and conduct of this study. And finally, I would like to acknowledge COLDA 2021 organizers. Thank you very much.